Hello, I'm Dr. Aaron Pinkasov, Chairman of Psychiatry Department at NYU Langone Hospital, Long Island, Professor of Medicine and Psychiatry at NYU Long Island School of Medicine. I graduated the Combined Internal Medicine and Psychiatry Residency Training Program at Downstate Medical Center at Brooklyn, New York in 1999. I became a passionate advocate for patients who are at risk for delirium because it sits right at the intersection of both psychiatry and internal medicine. Delirium is the most common neuropsychiatric disorder seen in general hospitals. If you go through any general medical floor and check on patients older than 65 years, about half of them would qualify for this diagnosis. When it comes to older patients in the ICU, the number exceeds 80%. Sadly, 2/3 of these patients are left undiagnosed. This really is tragic, since delirium is extremely neurotoxic, and the longer it goes on, the more neurons die in the brain, which robs those patients of their cognitive reserve. One of my first encounters with delirium was 20 years ago when an elderly woman was admitted for severe agitation to my geriatric psychiatric unit. There, I met a frail lady sitting in a wheelchair who was clearly in distress, very anxious and talking up a storm, except none of what she said made any sense. In fact, her speech sounded so much like gibberish that I was convinced that she had a stroke that left her with expressive aphasia. When I called her daughter, she informed me that her mother did have a history of small strokes in the past, hypertension and diabetes, but was fully independent and eloquent up until 2 days prior to admission. It was then that she became confused, disoriented, and incoherent. We discovered that she had urinary tract infection and that she was given a small dose of lorazepam in the emergency room because she was very agitated before she got to my floor. A CAT scan of brain showed ischemic white matter changes, but no new strokes, and after a few doses of antibiotics, her urine cleared up, and with that, her ability to speak clearly returned. I later learned that she was a retired pediatrician and had an illustrious academic career, and it's been my absolute pleasure and privilege to have her as my outpatient for the next 9 years, during which we bonded and she told me a lot of educational stories from her career as a doctor. Delirium occurs mostly in patients with a reduced brain reserve capacity, and this is why elderly patients with a history of cognitive decline, multiple medical problems, and multiple medications are at the highest risk. If left untreated, their cognition and functional capacity may become significantly damaged and may never return to their baseline. Delirium can and should be prevented. Be aware, watch out for signs of delirium, and please check the American Delirium Society website to learn more about ways to diagnose, manage, and prevent delirium.